I'm out here today to stand up for our patients. Many of our patients that are trying to get access to mental health care are finding that they're waiting really long periods of time to actually receive the health care. They may get a first appointment, but then they're delayed for second appointments weeks at a time. And the clinicians are here standing up saying best practices is timely access to follow-up appointments. So we are here today to advocate for this and to send the message to Kaiser Permanente that we can do better. There are a couple ways that I see this in the way that I deliver care, being a hospice palliative care home-based therapist, provider. The first way in which this appears to me is a lot of times I'll make recommendations to people to get some support through our mental health services, and people will roll their eyes at me. And it's actually really embarrassing to be an employee for Kaiser Permanente and to have to respond to their feelings about how hard it is to get an appointment, to even get a call back. I've had to actually call on behalf of some of our patients and say that I work here and that people have made calls to make an appointment and have heard nothing back from our mental health department. Additionally, how I've seen this show up in working with people is I've been facilitating a grief support group for 4 years, and people would come to the group. It's an open group, and people would come to the group and tell me and tell the group that they really had tried to get a one-to-one appointment, but they couldn't get an appointment, and then they were told to come to the grief support group. And you know, a grief support group is a great way to help people go through their regular grieving process, but when you have other types of losses like suicide or a tragic accident, sometimes the responses are super acute and they need more support. They're really more appropriate for one-to-one therapy. And I'm doing the best I can to help support everyone, but really find that they would be better served in a one-to-one appointment. And so I'm standing out here today to really advocate for what's right. People should have the kind of access to mental health care that they do regular health care. There should be no delay in them being able to get an appointment. There should be access that is readily available for all members, and there should be no disparity between either of the services that Kaiser Permanente provides as their insurance provider.